Oxytocin. Oxytocin is a 9 amino acid containing peptide hormone which is synthesized from the hypothalamus of the brain, stored and released from posterior pituitary. It is often referred as love hormone or cuddle hormone because it is involved in social bonding and attachment. Now let us try to understand about the release of oxytocin hormone. It is released from both males and females. It is released when stimulus acts on the body. There are certain factors or certain stimulus which will stimulate the release of oxytocin. Oxytocin mainly releases during physical touch, in hugging or when kissing, parturition, childbirth, suckling, breastfeeding, and coitus, sexual intercourse. These three are very important factors for release of oxytocin in females. Sometimes positive social interactions when we discuss or when we are happy talking to friends or family members, meditation, relaxing massage, and sometimes soothing music also can release oxytocin. As we have already discussed, oxytocin is stored in the posterior pituitary. Upon stimulation from the posterior pituitary, oxytocin along with antidiuretic hormone which is called vasopressin, it is released from posterior pituitary and it shows various actions in both males and females, but particularly oxytocin shows actions in females due to the presence of targets, due to the presence of oxytocin receptors in females. Now let us try to understand the pharmacological actions of oxytocin in both males and females. We have to keep in mind that oxytocin action is negligible in males due to the absence of oxytocin receptors, and predominantly the action of oxytocin is seen in females. Oxytocin contracts pregnant uterus. Because of its pregnant uterus contraction ability, oxytocin is considered as oxytocic or ecbolic. No action or very negligible action of oxytocin is seen in non-pregnant uterus and in early pregnancy. If action is required in non-pregnant and in early pregnancy, higher doses of oxytocin is required. The second action of oxytocin on the breast tissue, oxytocin contracts the myoepithelial cells of breast and it ejects the milk. On kidneys, oxytocin shows antidiuretic property. Due to antidiuretic property, it may aggravate or it may cause water intoxication. So when oxytocin doses are given, plenty of water or IV fluids are contraindicated. On cardiovascular system, oxytocin shows vasodilatory action. It causes blood vessel dilation and it may precipitate reflex tachycardia and it may cause flushing. Now let us understand the formulations of oxytocin. One thing it is very important that oxytocin is a polypeptide hormone. It is not effective orally, same like insulin. So it is available as nasal spray, sublingual tablets and topical gels. But most commonly used oxytocin is synthetic oxytocin injection, which is commonly used in IV infusion and also in intramuscular injections. Synthometrin is one formulation which is composed with oxytocin as well as ergotal colloid. 1 ml synthometrin contains 5 international units of oxytocin and 500 mcg of ergometrin in the combination, which is very effectively used as intramuscular injections. The pharmacokinetics of oxytocin. Immediately after absorption of oxytocin from the site of administration, either through nasal route or through sublingual route or through IM or IV, within 3 to 5 minutes, oxytocin is rapidly metabolized from the liver and it is excreted. Carbitocin is one oxytocin analog which is having long duration of action, which is very commonly used for postpartum hemorrhage. Let us understand the adverse drug reactions of oxytocin. Oxytocin has 3 adverse reactions. Whenever high doses of oxytocin is abused in hyperstimulation conditions, oxytocin may cause uterine rupture, fetal asphyxia and sometimes fetal damage, water intoxication due to antidiuretic response or antidiuretic action, and in cardiovascular system, as we have already discussed, it may cause reflex tachycardia or hypotension. Now let us try to understand about the uses of oxytocin. As oxytocin is a very famous uterine stimulant, it is very commonly used as induction of labor and it may also be used in postpartum hemorrhage conditions to stop hemorrhage, and it is also used in breast engorgement by intranasal route. So we have intranasal formulation. Intranasal oxytocin formulations can be used for breast engorgement. So these are some basic points about oxytocin and pharmacology of oxytocin. If you have learned something from our video, please don't forget to like, subscribe and share to your friends. Thank you for watching.